For an eating disorder treatment plan, every denied claim and failed audit traces back to documentation that doesn't match the care you delivered. If it isn't documented, it didn't happen, and it doesn't get paid. An eating disorder treatment plan has to satisfy two masters at once: clinical effectiveness and the documentation that payers and accreditors demand. We will cover the required plan elements, levels of care, the diagnosis and billing codes, and the golden thread that ties them together. So what does an effective treatment plan actually have to do? It is the roadmap for recovery, where the patient starts, where they need to go, and how they will get there. It is also designed to align with the professional standards and payer requirements your reimbursement depends on. And it is a living document, reviewed and updated on a set schedule, not written once and filed away. Eating disorders carry the second highest mortality rate of any psychiatric disorder, so care is intensive, and high utilization draws payer scrutiny. Plans that are vague or boilerplate raise red flags that care is not individualized, and services billed without documentation support get denied. Insurers may refuse to pay for services provided while the treatment plan was technically out of date. According to the National Eating Disorders Association, global prevalence more than doubled between 2000 and 2018, and coding rules keep changing. New severity-specific eating disorder codes keep arriving, so a behavioral health platform designed to stay current as ICD-10 updates keeps your coding accurate. Accreditors like the Joint Commission and CARF expect 4 things in every plan. Miss one, and a surveyor can cite your program. Let's walk through all 4. 1. The diagnosed problems. Document the specific eating disorder diagnosis as precisely as possible, including subtype and severity. Many clinicians list the code right next to the diagnosis. For example, anorexia nervosa, binge purge type, F50.02. 2. Clear goals with measurable objectives. Use the SMART framework, so each objective is specific, measurable, and time-bound, and can be tracked over time. Surveyors will cite a program if objectives are not measurable, so make each one concrete. 3. Interventions, each linked to a goal. List the modality, frequency, and who is responsible, and tie each intervention back to a problem or goal. This problem-to-goal to intervention link is the golden thread auditors and reviewers look for. 4. Signatures and scheduled review dates. An unsigned plan can be considered non-compliant in an audit, so capture the clinician and patient signatures. Record the creation date and review the plan on schedule. Many payers expect formal updates every 30 days. Higher levels of care use per diem codes, and matching the right code to the right level is where billing goes wrong. Partial hospitalization programs commonly bill the per diem HCPS code H0035 with a physician-approved plan and daily progress notes. Intensive outpatient programs bill per diem with code S9480 for private payers, only on days the patient attended the full program. For outpatient services, a handful of CPT codes do most of the work. Each billed code needs a matching note. Code 90791 is the initial psychiatric diagnostic evaluation, typically billed once at the start of care. Code 90837 covers a 60-minute individual psychotherapy session, common in eating disorder treatment. Code 90847 is family psychotherapy with the patient present, often central to adolescent care. And 90853 is group psychotherapy, used heavily in partial hospital and intensive outpatient programs. This is where a purpose-built platform changes the work. Behave Health is designed to support eating disorder documentation and billing directly. Treatment plan templates prompt for the required elements, diagnoses, goals, objectives, and interventions, so nothing critical is left out. Select the diagnosis once, and the platform is designed to attach the correct ICD-10 to each service so claims go out clean. Automated reminders flag when a plan update is due, helping prevent the lapses that lead to withheld payment. By keeping documentation and billing aligned one-to-one, Behave Health helps treatment centers reduce denials and survive audits. Stop letting documentation gaps turn into denied claims. See how the right platform keeps your eating disorder plans audit-ready. See Eating Disorder Treatment Plans, Levels of Care, and Billing Connected End-to-End. Book a 20-minute demo at behavehealth.com.